What I'd like to discuss with you today is the most common heart rhythm problem that we face in the world today, and that is atrial fibrillation. What occurs here is the upper left chamber usually takes over and beats extremely rapidly, between 300 and 500 beats per minute. When that happens, patients can feel palpitations, they can feel their heart beating irregularly. Of those 300 to 500 beats, about 100 or so, depending on many factors, gets down to the bottom chamber, which represents your actual heartbeat or pulse that you may feel. What happens is when the heart races like that, is you can feel short of breath, you can feel fatigued. Those are the most common symptoms patients have. But another very potentially serious problem is that blood can pool in the upper chambers of the heart when you have this condition, and a clot can form and pop off and cause a stroke if it goes to the brain. And in fact, it is the most common reason for stroke in the world, which brings us to the potential medications and other procedures that we can use to treat this common problem. And that is blood thinners. When we use blood thinners, we can reduce that risk of stroke to normal and eliminate it. There are different types of blood thinners, including Coumadin, which you may have heard of, and there are newer agents as well that don't require checking your levels of how thin your blood is. It interacts less with foods and other drugs. But importantly, all of those medications can prevent stroke. There are also other medications to minimize episodes of atrial fibrillation, and ultimately, we can potentially cure atrial fibrillation with a procedure where we eliminate the areas in the left upper chamber where the atrial fibrillation is coming from. And that can alleviate all of those terrible symptoms that patients have with atrial fibrillation and improve quality of life substantially.